Hi everybody, this is my presentation on evaluation of your home for falls. My name is Nancy Redick. A little bit about me, I'm one of our staff therapists at our Leroy and Batavia office. I graduated Nazareth College in 2002 and I've been with Leroy Physical Therapy since 2008. My areas of interest or expertise are postoperative rehab and low back pain, among many other things. Today's topics, we're going to do some brief statistics about falls in the United States. We're going to talk about some risk factors for falls, and we're also going to talk about the home environment. There's lots of places where people can fall, both inside and outside, but we're going to focus today on the home environment. So a couple statistics about falls. About 30 to 40 people over 30 to 40% of people over the age of 65 fall every year, and half of falls will result in injury. Direct medical costs from falls are nearly $50 billion a year. According to the National Council of Aging, 1 in 3 Americans over the age of 65 fall each year, making falls the leading cause of injury in older adults in the United States. Where do most falls occur? Give you guys a few seconds to think about that. Once again, inside the home, where most falls occur. I was a little surprised by this. My first choice was going to be bathrooms, just because of water and being in the tub and things like that. The most common place to fall in the home is actually the living area, so probably your living room. A study in 2000 by the World Health Organization reported that older adults fell mostly in the following areas. You can see bedrooms is a close second at 30%. Also kitchens, bathrooms, and hallways. According to the National Institute of Health, more falls occur on the same level, such as a flat surface, versus the stairs. Half of all falls resulting in injury, which is about 10% of those falls, are considered serious injury. So a serious injury would be something like a fracture, pretty deep bone bruise perhaps, but very commonly those falls could result in hip fractures. Most falls also occur while walking. So for example, people report tripping, catching your toe. 80% of homes contain at least one identifiable hazard, and 39% of homes contain more than 5 hazards, which we'll talk about different types of hazards here in a minute. And most falls, believe it or not, occur during the day. So 20% of falls are reported at nighttime. 3 key risk factors. Number 1 is environmental, meaning your home environment. The second key risk factor would be decreases in balance and weakness. So for example, weakness in your legs, your arms, your hands. And the third one is medication, which we're going to talk a bit about here in the next slide. So different types of medication, people are on many nowadays. Some of the common ones, though, can cause dizziness and confusion. Antidepressants and hypertensive drugs, so drugs for blood pressure, can be a common risk factor as well. And also if you're taking several medications, such as at least 4 or more. So now we're going to talk a little bit about some of the medications. This is a little bit of a lengthy slide, so I'll try to get through it as best I can. But this says that there's 3 types of medications that can increase your fall risk. So the first ones we're going to talk about are what are called psychoactive drugs. So those are medications that can affect the brain. So common ones are for what we call sedation or sedatives. So some of those could be lorazepam or Ativan. Another one that's common that we see is Valium, also known as diazepam, and also Xanax, which is called alprazolam. A common medication also is any type of antidepressant, so something such as Ambien, also known as Zolpidem or Zoloft, Celexa, Wellbutrin, and Effexor. Also, nowadays with pain complaints, people are prescribed opioids, and commonly we see those consisting of codeine or hydrocodone, oxycodone, morphine, fentanyl, and methadone. Another type of medication category that can cause an increased fall for increased fall risk would be those that are for blood pressure, so your hypertensive drugs. So commonly we'll see lisinopril. Lisinopril is probably the most common medication that I'll see patients list, at least in our offices, but it's a very common medication throughout the country. Also amlodipine, losartan, and hydrochlorothiazide. The third type of medication category that can increase fall risk would be those that lower your blood sugar, so diabetic medications. The most common one we probably see is metformin or glucophage, and also there's injections for insulin. Some other risk factors for falls. People who live in homes that have multiple levels, so example, a 1 or 2 story home, if there's laundry down in the basement versus the main floor. The reason that's a risk factor is because you think about how you get the laundry up and down the steps. You have to carry it, unless you're like my home growing up. We had a laundry chute, which was very nice, but you still have to get the clothes back up the steps, right? Another risk factor would be the number of people in the home. This is probably listed because if there's more people, there's more items in the home, perhaps more clutter. So if you have a lot more people in the home, I guess that puts it at increased risk as well. Also the use of a mobility aid. So a mobility aid is something like a cane, a walker, a wheelchair, or a scooter. Another big risk factor, which I think perhaps one of our other therapists talked about in a different presentation, is poor footwear or no footwear, and also dogs and cats. I have had both in my lifetime, and they both get in the way quite frequently, so that can definitely pose a risk. Another interesting one is small landings near doors. So this would be more near like an entrance, perhaps to the basement, or just getting into your home. If there's a very small landing and you try to open the door, it can be a little hard getting in and out, and that would put you at a higher risk. Also, another risk factor would be if there's a change in the floor surface or the floor texture. I know in several of my homes that I've owned, once you go across the threshold of a doorway, sometimes there's a little piece of trim or something like that. If you don't remember that it's there, right, that could definitely put you at risk. So some general recommendations. The first one would be to remove throw rugs. Throw rugs are any small rug, whether it's in front of a door, in the middle of a room. You're probably a little better off with a really large, maybe carpet or rug on a hardwood floor, but you still have to be careful about those larger area rugs because they still might have a large lip on them, which could be easy to trip on. So another one also is to secure carpet edges. So once again, if you have a big carpet rug or area rug that's over a hardwood floor, those edges could easily get caught on a walker or a cane or your foot. So securing that down safely can be very helpful as well. This is a big one. Removing objects from the floor seems kind of obvious, but we're creatures of habit and we tend to place things down sometimes. Like for example, you come in from the house after a day of work or being out and you put stuff down, right, that's heavy right by the door. So it's making sure that you remove things like that and some other objects that might be in the way. Reduce clutter. This is sometimes something that we don't notice, right? So we see something every day, we may not be aware of it or pay attention to it, but if you look around, I'm sure a lot of you could probably find that there are some things that you could pick up and just get out of the way to open up some space in your home. Remove wires and cords from the floor. This can be a tough one for some homes. I know I don't have any overhead lights in my house. It's all outlets. So when I use the light switch on the wall, if it's not a lamp that's plugged in, you're not going to be able to see in the room, first of all. But sometimes those wires are hard to keep along the edge of the wall, or even to tuck underneath, the carpeting to keep it out of the way. So keeping wires and cords off the floor can be a little difficult in some cases, but it's very, very important. I know with a lot of our high definition TVs and cable boxes and things like that, we can definitely have quite a few wires. So another good thing to do for wires is to find some type of zip tie or tape or clip. That way they're all kind of bundled together so you don't walk by and catch one. Adequate lighting is very important as well. I know one area in some homes that cannot be lighted well are hallways. You might have an overhead light perhaps, but sometimes hallways are pretty dark areas. Places where we eat, like kitchens and things like that, often there's a little more lighting than some of the other rooms. So just make sure that in the room that there's adequate lighting. Choosing chairs with solid armrests, that's important, especially it gets a little harder sometimes to get out of a chair, especially if you've been sitting for a while. So being able to use your arms to push can be a little bit easier. And avoiding low chairs. Low chairs can sometimes be very difficult to get out of as well. Installing handrails on staircases. That kind of seems like a no-brainer to me, but if you have a staircase that's only maybe 2 or 3 steps and there's not a handrail, that might be something that's pretty important to install. Also ensuring that your telephone is easily accessible. I know I haven't had a landline for probably 14 years now. My phone's usually on me, but you walk into another room, right? You leave your phone, you don't have it, it's ringing, trying to rush to get it. Definitely puts you at a higher risk for falling. So just make sure you try to keep that easily accessible. As far as rooms that we're going to talk about, a big one here, which we're going to see in a later picture, I'm going to ask you guys to point out some things you see that might put somebody at risk, or things that needed to be added to help improve the particular room. So the first one we're going to talk about are bathrooms. A lot of things that you can do in the bathroom nowadays. There's so many different options. I personally just remodeled a bathroom back in very early March, and it's very overwhelming with all the options you have for things to choose from. So a couple of basics as far as bathrooms go. Make sure you have grab bars, especially in the tub and the shower. Some tubs nowadays are a little higher or taller than the ones back from the 70s when my bathroom was originally built. So it's important that there's something safe and sturdy that you can hold on to when transferring in and out of the shower. Installing grab bars near the toilet, also very important. Installing a raised toilet seat. A lot of people don't realize, but your standard toilet is about 14 to 15 inches tall. Usually it's a little lower than probably a standard kitchen chair. So making sure that you have a raised toilet seat can be very helpful with getting up, making it safer for you in there. Also in the tub and shower, depending on the texture of the bathtub, you should make sure that maybe there's a nice rubber mat. I know the ones my mom used to use when we were kids had little suction cups on the bottom. That way they're not going to slide in the shower. But a rubber mat inside the tub can be very helpful. Also, when you're done with the shower or the bath, make sure you take up any floor mats that are in there. It could be a towel or an actual mat. Make sure it's off the floor, that way you don't trip on it. Something that is also very helpful, if you're having difficulty standing for a long period of time, using a shower seat can be very helpful. And then another thing, which I didn't think about till recently as well, once I was redoing our bathrooms, is where you're going to put your soap and shampoo. If you're able to have an adjustable shelf somewhere, that's great. I hate those ones that are adjustable and you stick in the corner. It's kind of like a little 5-tier shelf. It's better if you have something that's built in. If not, maybe just a little thing that hangs over the shower head. It's got a little shelf on it, so it's easy to reach and you don't have to turn around or reach down low to get something. Makes it a lot safer. As far as the bedroom, this is probably the most important thing. It's just adequate lighting. I know it's a place where we sleep. Some people like to do a lot of reading in bed, but it's very important to have appropriate lighting in the bedroom. Another one is to have a very clear path from your bed to the bathroom. If you don't have a bathroom that's close to your bedroom, so for example, if you have to go down the hallway, make sure there's adequate lighting there, nothing you're going to trip over that's on the floor. Glasses, phone, and other items should always be easily reachable. A night table or a nightstand that's right next to the bed works great for this. And also night lights. I know we think of night lights and kids, but I do not like to have it really super dark when I'm sleeping, so I always do have a night light. And you can put those pretty much anywhere. You can get even little night lights that just stick on the wall. Don't need any type of outlet or anything like that. So the kitchen. Also, it's important here to have adequate lighting. Make sure when you're not using doors, shut them. I'm notorious for this when I'm putting dishes away. I'll walk out of the room and then just leave the doors open, and not a smart idea, because if you're not paying attention, you could walk right into it. Putting daily use items in easy to reach areas. So pots and pans that you use every day or every other day, put them in a drawer where you don't have to bend way down to get it. And also you don't want to have to reach really high up to get it. A sturdy step stool. This is very important. I'm lazy sometimes, and what I'll do is just grab a chair. Not a good idea. Most chairs are made of wood, right? And especially if they're older chairs, they may not be as sturdy as they used to be. So a nice handy step stool. They make some really nice ones nowadays that'll fold right up. You can slide it right next to your refrigerator. Easy place to store it. I do not have hardwood floors. I don't even know if you wax hardwood floors anymore nowadays. But it's important if you do use a floor wax, just make sure that it's a non-skid wax. That obviously could make it very, very slippery. Outdoors, just a couple of pointers here. Make sure there's some adequate lighting along walkways. I see a lot of people will use solar lights. That's great for at nighttime. But sometimes just having maybe even a flashlight handy or a little flashlight on your keychain could be helpful. But just making sure you can see where you're stepping. If you've got any big cracks in the sidewalk or driveway, just try to repair them as best you can or call someone to do it. Installing handrails on the stairs or steps. I know they don't always look the prettiest, but sometimes those are some fairly easy things to have installed, which can make it a lot easier going up and down the steps to get in and out of your home. And I mentioned this earlier, but a large enough landing. So when you're leaving your home, you got a pretty small landing. It's hard to get the door open all the way, and you got to kind of wiggle around it awkwardly to get out, making sure you've got a wide enough landing. Also, something to consider is different weather conditions, right? People look outside, excuse me, it's snowing, it's raining, different weather conditions, you know, the driveway surface is going to be different. Just making sure you're aware of that, and also having proper footwear. So boots in the wintertime, flip-flops and sandals aren't the greatest in the summer, but I know a lot of people wear them. But making sure you've got good footwear. Some general reminders, just to review. Making sure you open up space in your home by decluttering, moving furniture, and just generally getting objects off the floor. Improving lighting. That's probably one of the biggest mistakes people make with their house, is they just don't have good lighting. That's probably one of the most important things. Proper footwear. Some people that deal with foot problems, I've had an issue myself, and mentioning just trying to get a pair that you wear just inside your home. I don't like to wear shoes in the house, but if it's a brand new pair or one that never goes outside, I would have no problem wearing shoes inside the house, and that can be very helpful for those of us that have foot problems and balance problems, just having a nice pair for just inside. And generally just being more aware of what's around you. Things we look at every day, sometimes we don't really think about them, but if you just take a few moments and just take a general look around, you might be a little bit more aware of where you could have some things that may be at risk for you falling. Also, don't carry more than you can handle. So taking more frequent trips. Groceries, you're carrying laundry. If it's too heavy and you're struggling, take 2 or 3 trips. So this next slide, it actually looks like more of a fire hazard to me than anything. I'm just going to give you guys a couple minutes just to kind of scan the picture, and then we'll talk about a couple of hazards that we can see in this picture that I talked about earlier that could be putting us at risk for falling. Excuse me. All right, so the first one that I see that is the most obvious is that big puddle of water on the floor underneath what looks like the dishwasher. Definitely need to get that cleaned up. Not to mention there's about 4 items plugged into that outlet there on the wall, and you can see that big long cord hanging across the floor. Not a good idea. That cat there eating its food, definitely not a good place to feed a cat, right? You're busy washing dishes, you turn around, you could trip right over that poor little kitty. Also, I see probably 2 cupboard doors that are open, right? You walk and you're not paying attention and you run right into one of those things, definitely there's a possibility you could fall. I'm not sure what's going on in the stove other than it looks like there's 2 fires. But the thing I noticed mostly, besides the oven door being open, is the handle on that pan. It is turned straight out. So if you walk by that, not going to be good, right? You're going to have grease all over. You're probably slipping something, who knows. So just turn that handle so it's not hanging over the cupboard. Also, the trash can right in front of the sink, not a good spot. That's something that you should either put in a different location or perhaps put it inside the cupboard there. All right, this next picture, I'm going to give you guys a couple minutes once again just to glance over, and we'll talk about a couple of items that I would recommend changing and also adding. I will say though, that looks like a very nice clean bathroom. All right, so first thing that stands out to me, since this is a kind of a colorless looking bathroom, is the bright purple floor mat that's right there down on the floor. I doubt that thing has tape underneath it. It's not secure, right? It is definitely something that is a major trip hazard for that bathroom. Second thing is I do not see any grab bars anywhere near the shower. I'm assuming that middle door opens. There's nothing to hang on to whatsoever. There aren't even any towel bars nearby, except way over there behind the toilet, which looks like it's a pretty far reach if you're getting out of the shower, right? Looks like you gotta walk all the way across the floor to these little yellow towels over here across the room with wet feet, right? Not a good idea. As far as the toilet, it doesn't look like there's really anything next to it to be able to push up off of. So maybe some a raised toilet seat or some grab bars nearby would be helpful. Excuse me. Other than that, as far as the lighting, it's kind of hard to tell from the picture, but I think the vanity is way over there on the left. It looks like that's pretty much the only lighting in that bathroom. There's nothing over here closer to the toilet or even perhaps at the ceiling. So definitely some things to change in that bathroom for sure. I do like, however, that's a nice walk-in shower. Don't have to step up over a tub or something like that. Also looks like there's a detachable or handle shower head, which can be very helpful as well. All right, so just a couple of websites that are quite reputable to check out. First and foremost is the National Institute of Health. Always a great website for checking out medical information. With the internet, unfortunately, there's some good websites and bad websites to get information from, but that's definitely a gooder one. The Centers for Disease Control, World Health Organization, and of course my favorite, the American Physical Therapy Association. So as far as physical therapy, big question we want to ask, right? How can physical therapy help? So if you think you're having some trouble with falling, you're worried about falling, you feel like, you're just not quite as steady as you used to be, lots of things we can do with physical therapy. So first and foremost, a PT can help you to determine if you're at risk for falls and also at what level of risk you're at. So there's a lot of different balance tests we can take you through, as well as recommending any type of adaptive equipment such as a cane or a walker. Number two, a PT can help you determine if you have any loss of flexibility or range of motion, and also if you have any weakness or lack of strength. Number three, a PT can design a specific treatment plan to address your very much individual needs. It's very important. One of my biggest pet peeves is when I hear patients come in and they were given just some general exercises and were never really taught how to do them. That's probably one of the most common things we hear. So it's very important that you get a very individualized plan, which is what we do in physical therapy. And we can determine if you need regularly skilled PT, if you just need a home exercise program, or if we could perhaps recommend any specific exercise options here at Village Fitness. So as far as making any contact with us, a lot of you know what our phone number is, but we're listing it here just so you can see. So if you have any questions, you can call me directly. You can call the office. Like I said earlier, I'm between Leroy and Batavia, usually a couple of days a week at both places, so our numbers are all listed there, and you can also visit our website. Another quick pointer is with physical therapy, You can do what's called direct access. That means you can come to see a physical therapist directly without a prescription from your primary physician or any other physician. This has been established since 2006. Believe it or not, a lot of people still don't know about it, but it's a great thing. So what direct access gives you is 10 visits of physical therapy or 30 days, whichever comes first, before you would need a prescription from your doctor to continue. Direct access is covered by most insurance companies, but you can also check with us to see if there's any limitations. Any questions? Probably not, since we're not doing this live, but if there are, once again, call the office. My email is listed here as well, and we'd be happy to help you out. And thank you for attending. We'll see you next time.